In June this year, they were seen on TV for less than a minute. But it was long enough to outrage viewers. Well, there can be no excuse for what they did. Maybe there's an explanation. What are the stories of the nursing aides working amongst us? 2% of Singaporeans aged over 65 are living out their twilight years in nursing homes today. Who really cares for them?
They are beating us, but we cannot do anything about it.
I want to advise them, if they want to come and work in Singapore, they better to work at the hospital.
Working time is so long. Public holiday also, after my friend all go out, I'm be there working, no day off. No overtime.
Halima signed her first contract with a Singapore private nursing home in 2007. As a family's sole breadwinner, she paid an agent almost $2,500 to find her a job in the healthcare sector in Singapore. She had worked as a staff nurse in a hospital in Myanmar and has a degree in chemistry and a diploma in nursing. The agent could only find her a job as a nursing aide in one of Singapore's 63 nursing homes. What was your first month at work like? Was it shocking for you?
I very realized and great mistake because I come here. We are starting the morning bathing time. After finish, we are cleaning the whole ward, including toilet also. So my life very shocked.
You have no general cleaner?
No, don't have.
Halima and thousands of foreigners like her form the backbone of the elder care sector in Singapore. This is because the Ministry of Health, or MOH's Medical Audit and Accreditation Unit, only requires 15% of the care staff in nursing homes to be local. And this 15% can include Singapore permanent residents and S-Pass holders.
In all my recruitment drive, I try to recruit local Singaporean. I have great difficulty. And as the population ages, where will we be heading without these overseas workers?
These nursing aides usually come from developing countries such as Sri Lanka, India, Myanmar, and the Philippines. They care for the elderly, feed them, bathe them, change them, ensure that they take their medication on time. They also double as garbage collectors, cleaners, and physiotherapists. Their monthly salary, on average, $250 to $400.
It's too low. Yeah, cannot buy anything. Then I have to send money back to my parents.
There are altogether 63 nursing homes in Singapore, providing a total of 9,300 beds. 31 are privately run. They cater mostly to full-paying residents. The rest are run by voluntary welfare organizations or VWOs like Peacehaven. Those mostly cater to low-income families who can't afford the charges. These homes depend on MOH subsidies and donations to meet their operational costs.
Generally speaking, there isn't enough financial resources available to really run quality of care. The bulk of the costs really from homes as well as community service are the manpower costs. And the manpower costs, if it's not enough, then of course you hire fewer staff, make them work longer hours.
The MOH guideline for staff-to-resident ratio depends on the category of residents housed in a nursing home. The ratio can range from 1 staff to 30 patients to 1 staff per 2 patients. However, this ratio may not always be strictly adhered to.
At the bathing time, we have the 100 residents to bathe, but start with the about 5 only. So they get the time is the 1 person is each 3 minutes only.
In our case, we have 100 patients. Where nursing aid on duty is 9 only. So if some patients call at a time, so how can we attend?
Most nursing aides Gedriel spoke to have to work up to 12 hours a day. As shift workers, the Employment Act permits them to work these 12 hours as long as they don't exceed an average of 44 hours a week for 3 consecutive weeks. It doesn't say anything about how many days in a row they can be asked to pull these 12-hour shifts. So many of these nursing aides have to work 12-hour days, 3 days in a row.
I think management selfish because this is business a lot of. We are nurse, come here and look after patient only. He thinking all the time is money like that. Go do that, this do this, that.
Madam Lau has a support system in place for her nursing aides. Sharing sessions held every week help them handle the stress of their work. According to a study reported by Health.com, nearly 11% of people working in elder care admit to a bout of major depression. Is it simply due to too many diaper changes and too few pennies? Or are there more intangible stresses? After the break, I try my hand at the job that most Singaporeans don't want. In Singapore today, 1 in 11 people are over 65 years old. By the year 2030, this number is expected to double. 1 in 5 will be over 65. Many of these elders may come to call one of Singapore's 63 nursing homes home, where they would be taken care of by people like our senior Dela Cruz Salvador. Our senior has been working at Econ Medicare Center, a private nursing home, for the past 11 years. Work for her begins at 6 a.m. and I'll be working alongside our senior today. So I've got the uniform on. Let's see if I have what it takes to actually do the job. Our senior's colleagues had already begun showering the residents. Boots as well. Perspiring. Both of you are perspiring so much. Yeah. Just like me. Let me help you. This is one of the duties that a nursing aide would have to perform at least 3 times during the day, and that's change the diapers of residents who are unable to relieve themselves in the restroom. And if they're suffering from diarrhea, it could be twice the usual number of diaper changes. For 4 hours straight, our senior and her colleagues didn't stop working. By 10 a.m., I was starving and definitely in need of a break. What are the rewards for you?
When my patient is very happy and comfortable of my care, when the sponsor never complain about my care, I am very, very happy.
This fear of residents or family members complaining is one that's shared by many nursing aides.
We have one colleague sent back to the Philippines because he was joking to the patients
patient is suffering from dementia, and then the patient take it seriously and then complain to the relative.
Then the relative complain also to the management.
There are 104 foreign nursing aides working in Peacehaven with Madam Lau. She received about 6 formal complaints last year from family members.
When you're not sick anymore, I can buy. I also asked the main caregiver, please respect my staff. Please do not abuse my staff. Because, they may be foreign worker. Foreign worker in Singapore have also, the Filipinos or Myanmar have also worked in the household as maid. But over in Peacehaven, over in nursing home, they are not maid.
One of the key things that can help our frontline workers to be meaningfully engaged in their work is really the respect they might get. Sometimes it's not even the pay.
There is little job progression in a nursing aide's career. Our senior has been working for Econ since 2000, and even though she's been promoted to senior nursing aide, her duties remain largely the same. Many nursing aides in Singapore are disheartened by the lack of opportunity for career progression. In terms of your career, do you see a future?
Yes. If my institution will allow me to take my enrolled nurse here in Singapore, then maybe I can say it's yes.
For many nursing aides, this is a pipe dream. Nursing aides who are nurses in their native countries have to pass an exam administered by Singapore's Nursing Board to become certified as enrolled nurses in Singapore. While the exam only costs $25, the rule is that they have to have a job offer to be an enrolled nurse here at the time of application. Since all nursing homes only require 15% of their care staff to be clinically trained, and this includes doctors, registered nurses, and enrolled nurses, there are very few enrolled nurse positions available at a typical nursing home. So many nursing aides have to remain as nursing aides for their tenure in Singapore.
We also need to realize that because once the staff become enrolled nurse or registered nurse, they all can resign and join the hospital.
Most nursing aides are instead sent by their employers for the Institute of Technical Education Skills Certificate, or ISC, in home care services. With the ISC in home care services, nursing aides are allowed by the Ministry of Manpower to stay and work in Singapore for a period of up to 18 years. Without it, they're only allowed to work in Singapore for a period of up to 4 years.
But why? How we
Do all the nursing aides at your nursing home have to attend the IT course?
Yes, every year we are company sent to their staff go to IDE. You already take ready. You stay there longer to Singapore, but you don't need to pay there any cent money. But I will send to IDE go 6 months. But you will stay with me and then contract bond years, 10 years time.
This deters many nursing aides from wanting to go for training. At present, there's no mandatory standardized training program for nursing aides and healthcare assistants before they start working full-time in a nursing home in Singapore.
There you go. The most important is the tongue. The tongue we can clear out. Sometimes
I don't think
the moment they arrive in Singapore, it is considered as our staff and we are paying them. Okay, so you need the financial resources to be able to send them away for training, and for how long?
The issue looks set to become more pressing. 6 new nursing homes are to be built by 2014, adding 1,000 beds to the existing number. 1,000 elders who will need 24-hour care from foreigners, just like our senior. Well, we're back at the nursing home. It's 4:15 p.m. Our senior is actually done with the shift. She was done with work at 2 p.m., but she chooses to come back here at around this time every day just to help her colleagues serve dinner to the residents.